ClinTrial Refer is an online resource and app that allows you to quickly search for up-to-date trial information. So it's useful, firstly, for patients who are diagnosed with advanced skin cancers. You can search for trials that they might be able to take part in as part of their management. And secondly, it's useful for myself to keep up to date with current trials in progress. It can be a platform to list your own trials for recruitment, and it allows referring specialists to contact you if they have any questions about trials. I deal with a high number of patients with complicated skin cancers, and when a patient's in my room, it allows me to do a quick search for relevant trials, which could expand your management options. Nowadays, we're making fairly large leaps and bounds in the treatment of complex melanoma, and it's important to be able to find and offer the latest advances to patients. So as part of the doctor-patient relationship, it's good to be able to sit down with a person at the point of care and help them navigate all the options for managing their illness. And you can give them the confidence that you're actually looking at all of the treatment options. And patients also have the ability to use the database on their own. So educating and empowering people to research and positively contribute to their own management can be hugely important to them. Well, ClinTrial Refer is a free service for patients and clinicians. It's accessible via browser or app formats, though there are a few different ways to access it. And it lists a large number of trials. So importantly for the patient, it allows you to narrow the search criteria. So depending on the patient's specific condition, the level of severity, and geographical location, you will have a range of trials to choose from. And what I like best about that is it provides the information you need to make decisions about trial eligibility, such as the inclusion criteria, the phase of the trial, and very usefully, it also provides the details of the research coordinators in case you need to get in touch. As part of my management discussion with the patient. So when we're sitting face to face, we can put the details of the condition in, do a search, and discuss trial-based options that might not be commonly known about, even if they've been referred from the hospital for follow-up. And I also refer it to patients as a resource they can search in their own time. I mainly use the desktop option because the patient and I discuss management face to face. So usually it's in the initial stages of diagnosis, and most people diagnosed with cancer might need assistance navigating the terminology, the staging of the cancer, and I can assist them putting those details in. I'd probably use the phone app if I was in conferences, in a multidisciplinary meeting, or as a quick search tool when I'm out of the practice doing work. If a colleague is really driven, as you'd hope we should be, to provide comprehensive, modern and holistic cancer care, part of the management should be using appropriate resources to guide patients through their cancer journey. And I'm always inspired that patients who are diagnosed with complicated cancers or serious genetic syndromes quite selflessly in most cases want to contribute to medical research. And allowing this when appropriate can be a very ethical decision that has the potential to benefit the patient.